basically the question is, which is greater risk, the risk of COVID or the risk of adverse effects of the vaccine? I don't think I would have thought of it quite that way, but it's a great question. So let's consider, what are the risks of COVID? The 16 million cases of COVID in the United States so far probably markedly underrepresent the number of cases that have actually occurred. You know, we all understand that there's a large number of patients who become ill with COVID and may not be all that sick, and they won't even go to the doctor to be tested. Incidentally, it's been a pain in the neck to get serology done or viral testing done, and I personally have had 5 instances of getting the viral test done. And in the first 2 times, it took close to 2 weeks for the results to come back. So it's been difficult, to say the least, to even be tested for COVID. And as you might understand, a high percent of people that probably had COVID infection but weren't all that ill never bothered or weren't able to get the test. So what does that mean? We probably have at least 5 to 10 times as many cases of COVID in the United States as has been documented. So if it's 5 times, it would be like 75 million cases of COVID that have actually more likely occurred in the United States. We have to consider that as part of the risk. What I just said about the incidence of disease probably also can be said with the number of cases of deaths. So there have been 300,000 deaths from COVID in the United States thus far, and it's quite likely that that number is considerably higher, 2 to 5 times that. So when we're talking about the risk of COVID, we have to keep these numbers in mind and remember that the hard numbers that we have are probably underestimates of the real threat and the risk of this disease. Nevertheless, we can say overall, about 80% of patients who get COVID infection have either no or very mild symptoms, 80%. So the great majority of people do quite well with it. 20% have severe or critical illness. So about 15% are severe, probably need to have oxygen, may need to go to the hospital. And 5% are so severe they have to go to the ICU. And there's a 2% case-based mortality. So if you just, what that means is if you take the 16 million patients who we know were infected, and you consider that 300,000 cases died, then that's about 2% of the total. That's a case-based mortality. Compare that to the case-based mortality from the vaccine. There isn't any mortality yet known from the vaccine. So the comparison is immediately remarkable and would seem to justify the vaccine over the COVID risk. Now let's see, I have a note here that we have to also consider the risk because the numbers we have don't really reflect the reality of this disease. It's a moving target and it's rapidly accelerating. So we are in a phase right now in the United States and around the world where this disease is spreading like wildfire throughout our country. I just earlier gave you the numbers of how it's increased dramatically since May. 10-fold increase in number of cases, 2 to 5-fold increase in the number of deaths. So we have to try to understand the risk in terms of this being a dynamic and a dangerous trend. I want to emphasize something else that your question gave me pause on. We're talking about what is the greater risk, that of COVID or the greater risk of vaccines. What are the risks of COVID? Well, the immediate risk of COVID is illness and death. But let's think for a minute about the other risks of COVID that we're all experiencing. We weren't able to have Thanksgiving with our family this year. We're not going to be able to have Christmas. We are really sheltering in place. Isolation has increased. There is a tremendous impact on our socialization and a very, very meaningful family and social ties. That's a risk. That's a cost to us, a great note. There's increasing incidence of alcohol and drug use and depression. So when I talk to my friends in Covenant Community Care that are working in the recovery center, the annex off the Michigan Avenue, they're seeing increasing numbers of patients who are having trouble with drugs and alcohol and depression. Suicide rate is up. Remember that the COVID has so eclipsed, should I say, other diseases that many patients who have early undetected cancers are not being detected. Diabetes is out of control. Many of my patients who are sheltering in place are depressed, bored, they're eating too much, their diabetes is out of control, they're gaining weight. We know this, and the cost, therefore, the risk of COVID markedly extends beyond just the immediate health risk of the virus itself. Think about the economic fallout of this disease. People have lost jobs. They're losing their housing. The cost in terms of money is, I can't even put a value on it. Think of the healthcare workers in urban and also increasingly rural care centers who are just becoming exhausted. Their hospitals are filled. Their ICUs are filled. We can't keep going on like this and continue to care for patients the way we're losing healthcare providers and on and on. This is having a dramatic, excessive impact on the African American community and the Hispanic community, and the list of side effects and risks goes on and on, well beyond just the immediate illness risk caused by the virus itself. So while we're thinking about risks, then we have to extend our view of what the risk for COVID is. And clearly, in my mind, it makes the utilization of the new vaccine, without question, something I will personally take as soon as I can get it. And I advise us all to do so, if at all possible.